Welcome back to the show. Like we said at the beginning, we get to check in with one of our dear friends here on The Blend, and it's really during a very important time. Carly, you and I have been talking, and you saw personally, people cannot get enough of pools during this pandemic, and rightfully so.
I know. Here we are in summer, and you hear the stories about above ground pools being sold in record numbers, people getting pools installed, which kind of makes sense. That unfortunately we have some sad news to report this morning. Dr. Jen, we're going to bring her in, Dr. Jen Arnold, because we are seeing, unfortunately, an uptick of drownings and accidents happening with families in the pools. Again, I mean, we've talked about this is what families are doing. It's one of the few things that I think families can enjoy right now. So it's no surprise that accidents kind of follow that as well. But there is good news because they are preventable. And we're going to talk about a lot of those measures, things that we can do today to hope, have families enjoy themselves around the pool and around water here in Florida.
Absolutely. Well, thank you for having me on today, because this is something that I just hope that all parents can take something away to help protect their child, because we are seeing, essentially almost a pandemic of drownings. And we know that drownings, unfortunately, across our country are the second leading cause of death in children under the age of 4. And children ages under 4 are the most high risk. And again, it's usually not because parents aren't well intended. It's no one's fault. It's just that kids are kids. They explore, they get into trouble. And so we have to figure out how we can layer in protections to help prevent that worst case scenario from happening.
And it sounds like when you're talking about layering in, you kind of take into account how comfortable a child is with water along with their age. Two important factors to say how you begin this layering.
Absolutely. So, that first piece of sort of training your child to be as safe as possible in the water starts with, less than one, getting your child exposed to the water safely with you as a parent who knows how to swim, exposing them, getting it to not be something that's scary. And then, the American Academy of Pediatrics recommends starting swim lessons anywhere from ages 1 to 4. And, a lot of those decisions on swim lessons are going to depend on your individual child and their readiness. But it is really important to start with a quality swim instructor and to also focus on the survival skills. That's first and foremost. And then if you want to go on to Olympic swimming beyond that, that's fine. But start with survival skills training early.
Well, and I want to make sure, Dr. Jen, that you share the numbers that you shared with us before we got started, because, we're not talking about nationally. We're talking about locally, right here in the Bay Area, where families this has hit home for them.
Absolutely. We've seen an exponential increase in the number of drownings at our institution. Just since the pandemic started, since we had our stay-at-home orders, 24 drownings alone. And that's, that's, a dramatic increase. And so it's scary to us. We're worried because we are seeing this affect kids of any age, but really those less than 4. And we know that it's something that is preventable, but it's so easy to happen. So we want to
telling me that it's not during necessarily swim time where all everyone's hands on deck and you're having a good time. Are kids getting, what are we seeing that we need to do a better job of as a community and as families?
Yeah. So, really the majority of the time, swimming, non-swim time is when a drowning happens. So again, it's an unexpected 5 minutes. A child isn't supposed to be near water, but gets out through a door, makes it to a bathtub or a toilet, so, a bucket of cleaning water that was left. So really to help think about that next layering piece, there's training or swim lessons, but then there's also the need to make sure your environment is protected as much as possible. So avoiding any containers of water that are available or exposed to your child to get into, because kids are kids. They're exploring, they're getting out there. To put alarms on doors and windows, to have a fence around any pools that you have that not only is fenced, but has an alarm potentially, and also has a door that opens, outward, not inward, so the child can't push it in. And so thinking about layers of barriers to help keep your child from being exposed to bodies of water, even small buckets of water, is really an important piece of that puzzle.
I know sometimes you hear of people having these big pool parties and you point the fingers. I thought you were watching. I thought you were watching. You say there's a really easy way, just as a reminder as adults, whoever is supposed to have a lanyard, they're the ones that need to keep their eyes on the pool at all times?
Absolutely. Again, even if you have a lifeguard, it's important to have an identified adult who is also, knowledgeable in how to swim, available and identified. Because again, when you're having a gathering at all, and granted, we're all not gathering the way we used to, but we still are, potentially within your COVID bubble. You might be there with your spouse or a friend, and so you want to make sure that the person that's supposed to be checking and monitoring every second has that lanyard, because it's a nice cognitive reminder that I'm in charge of this. And when they need a break, they pass on the lanyard to somebody else so we can take turns so that one person doesn't get burnt out.
I know another thing that's very important to you that we've talked with you about before, but I think we can't stress it enough. CPR. How important is it that family members, really anyone and everyone, can be trained in that?
Absolutely. Because again, you think about the layers. You want to prevent the exposure, and then you want to help, prepare your child to be as, able to survive as much as possible if they're exposed. And then last but not least, if the drowning happens, you want to know how to save your child's life if need be in that horrible moment. And so CPR is really key. Infant and child CPR. I think everybody who is involved in caring for kids should learn that. There are, again, CPR classes available, but there's also even online. You can order CPR kits at home with videos and a mannequin you can blow up so you can practice and train anyone in a COVID safe environment. So I think it's really key for everyone to learn basic survival and CPR skills.
Jen, as always, we appreciate you being able to come on, talk about this important topic. We see too much of it here in the Tampa Bay and Florida area. So take care of yourself. I hope you stay well, stay healthy, and stay in touch, okay?
You too. Stay
Dr. Jen.